Hi, I'm Divyam Singh, and welcome to my LifePage. Today I'll be discussing about healthcare management, but before that, let me tell you something about myself. I went to school out here in India at the Doon School, and after I completed my schooling, I left the country to go to the US to do my bachelor's in Washington, D.C. in biological sciences. After that, I worked in hospitals. I gained some experience in healthcare itself, and after taking that information and experience with me, I applied for my master's in public health at University of South Florida in Tampa. And while I was working in Tampa, I also got to work with a company that was working with our university itself, based with electronic medical records. And yes, and recently, after I completed this project and that job, I moved back to healthcare management. Is actually a much broader term, which means that it prepares students or individuals working in the hospital and trains them to be leaders in their own fields, whether it is nursing, whether it is clinicians, whether it is on the tech side in hospitals. It basically teaches them the skills and the right things so that patients and doctors and hospital systems can work efficiently and without any problems. And at the end of the day, everyone goes home safely and soundly and happy. Itself. If you're going to be working in healthcare or hospital systems, it is always a good thing to know about a person's body, about the ailments that come with it, about how they're treated, not to the very depth of it, but just an overview as to, how many bones you have, what systems work where, what happens when you get sick. Simple things like that. Obviously, schooling or even in undergrad, it's a life learning process. But I think it is definitely something that you should know before entering healthcare, or have something of a passion about, to learn about the human body. Communication. It's basically your behavioral skills. It's basically your communication skills, how you talk to people, how you're perceived, how you talk to doctors above you, how you talk to your peers, how you talk to the patients coming in. You have to realize if a patient is coming to a hospital, they already have a very grave illness or a malady that is annoying them and has caused issues in their professional or their personal lives. Now, you have to be very sympathetic to the cause that they're coming to you for help. You have to put them in place and put them in touch with the right people who can help them correctly. Even if someone walks in with a cardiac issue and you are in a dermatology clinic, you need to give them as much information into individual health. Yes, you might work in one office that sees the same kind of patients constantly with the same ailments in comparison to, for example, a general clinic that sees patients with wound shots, they see patients with bleeding arms, they see people with athlete's foot and everywhere. But that does not take away from the fact that you are helping an individual fix their problem. Take pride in that. It is good that you help somebody. How many people are willing to do that? In today's world, we need more people to take pride in their work hours, which is a given with hospitals. It's not about just long hours. It's also about you'll get a random call in the middle of the night being like, come in to work. Depends on your job, of course. If you're a student or if you're just starting off, they will probably not do it unless you're in medical school and actually responsible, and they want you to learn the trade really fast. But even then, you should always realize that around 5:36, get ready. An hour of commute for me, taking the bus or whatever have you. I'm actually one of those people who actually picked up the paper and read the paper on the bus on my way to work so that I knew what was happening, because I was not huge on smartphones then. This was 2007. The first iPhone had just come out. You probably don't remember it. And as soon as I got into work, you get 5 minutes to keep your things down. And you know what? When they say the office opens at 8:30, people will start pouring in at 8 o'clock. Your phones will start ringing. It was me and one more person dealing with everything when I was working initially at the gastroenterologist. And you're just running around. Basically, you don't know where time goes. That's one good thing about working in hospitals. You don't know where your days go. Around 12:31, the doctor took a break for an hour, hence we got a break. But our break was, well, it was more of a, oh, let's get this done while the doctor's away, rather than an actual break. I used to eat my lunch while on my feet. I was just running around from room to room. That's how I used to eat and that's fine in hospitals. You also become a health freak. So I was walking around with celeries in my pocket, and eating them during lunch. And you get done, I used to get done by around 4 or 5 p.m. So basically starting at around 8, getting done around 4 p.m. And I think that was great. When I was working in the tech company for the electronic medical records, I didn't even know that there were so many little things about electronic medical records that people thought about, from font sizes to asterisk marks to printout formats. It was so amazing to sit with a design team, to sit with the nurses, to sit with the doctors, to see what their problems were, what they wanted this new system to look like. And, I loved it. I hope I was helpful in giving you a balanced view on healthcare management. Thank you.